I'm here at Summit House in Dudley with Mark Ellerby, and we're both part of Building Health Partnerships in Dudley. Building Health Partnerships is a national programme that's looking to improve health outcomes by bringing together partnerships between clinical commissioning groups, local authorities and voluntary and community sector organisations. Dudley's one of 12 learning sites for the Building Health Partnerships programme in the current year. And we've had a few sessions that have brought together colleagues from the clinical commissioning group and some voluntary organisations. Having done that and recognised the challenges we face, Summit House came forward to share a process that they've been working hard to develop and have been testing and implementing with great success, and wanted to see if there was interest in sharing that amongst other voluntary organisations and with the clinical commissioning group in Dudley. So Mark, can you just describe briefly what the model is?
Yeah, we've been working on a model called PSIAMS, which is really a whole system approach to customer intervention work. It allows us to measure social impact, it allows us to measure social value, it also allows us to give an indicator around social capital as well for all of the customers that we work with. It's a tool that helps us follow the customer journey, and through that journey we look at all of the support needs that an individual would have and how we can best work with them to develop an action plan to support them in the future.
And we're here at Summit House today because you invited the organisations that expressed an interest to come together and think through whether they wanted to and how we could take this forward. So can you just describe the outcomes of the meeting we've just finished?
Yeah, really good meeting today, and I think some of the things that are coming from that are that we are going to do a pilot by looking at a group of organisations that are going to work collaboratively to see how we can implement the PSIAMS process across all of the organisations that are a part of the pilot, but also to specifically work with some smaller organisations that may be more community-based, that maybe don't have the infrastructure and resources to buy in a CRM system or develop a system that will allow it to capture this information. So we're going from a broad range of organisations that will allow us to have a real good representation of the population of Dudley.
That's great. And as well as organisations being able to use the information and the analysis for their own service development, we'll also be able to bring it together to look at maybe whole Dudley Borough responses to challenges and joint bids and so on. Yeah,
I mean, it's in terms of capturing the data, one of the things that we will be able to do with that data is to look and see what are some of the current issues that people are facing that maybe it's not being addressed, or what are some of the future needs of some of our communities, and actually start to form partnerships with organisations, both large and small, to develop a consortium approach to solving some of the problems that we're facing.
That's great. And I suppose the other thing to add is that Dudley Clinical Commissioning Group are thinking along similar lines to us on this and are really interested in what we're doing.
Yeah, hopefully, and I think also, it's good because, some of the greatest need at the moment in terms of solutions is in the area around hospitals and GP surgeries, the volume of people coming through and how we can help reduce that volume.
That's great. Thanks for your time, Mark.
Thank you.